Namaskar and welcome to the Friends FM page right here. I'm absolutely live and we are streaming live with iconic personalities from the Fortis Hospital. Gentlemen who day in and day out, and of course a beautiful lady also there, all of them who really take care of us day in and day out from Fortis. And let me tell you, one of my colleagues walked into Fortis day before yesterday, and he felt that he's walked into something truly amazing. There wasn't a speck of dust. It was clean. It was organized. It was in a very systematic way arranged so people know where they're going and where not to go. First of all, a warm welcome to all the lovely doctors this beautiful afternoon, and we are streaming on Facebook Live. Doctors, firstly, a big salute to all of y'all. COVID or non-COVID, y'all have always been a source of encouragement, always been in fact, right now when I'm talking to all of y'all live, I'm already feeling with all the josh, all the energy. And if I had even a small cough, I'm feeling absolutely fine. It's so wonderful to have y'all with us right here on Facebook Live, across, and of course, the icons of the Fortis Hospital. And I'd like to start off with a gentleman, since I do a show called Direct Dil Se. I'd like to start off with a gentleman who is the doctor of the heart. And I'm sure he works so much on the heart, literally gets people to live a beautiful life. By the time on air, I also connect hearts. Yes, a warm welcome to Dr. Shuvanan Ray, Director, Department of Cardiac Sciences, Fortis Hospitals, Calcutta. Doctor, a warm welcome to you right here on this live stream, which is going on Facebook.
Thank you.
So wonderful to have you with us. Then I would like to go on to Dr. Sibabrata Banerjee. He's consultant, Department of Internal Medicine, Fortis Hospitals, Kolkata. Dr. Banerjee, it's so wonderful to have. I love your back screen. I love your style. And when I first saw you there, I thought, ekta Tollywood actor ishe gelo khane. But thank you so much for joining us. And I'm just curious, what is that background behind? What is it actually?
Actually, this is the virtual picture of coronavirus right at this moment.
Oops. Well,
so we are dealing with corona. So I am always carrying corona behind me so that I can run and I can run.
Well, that's nice, doctor. That's very, very nice. Next, we have a lady on this amazing panel of iconic personalities. And of course, she is one. Dr. Sanjukta Dutta, Head Emergency Medicine, Fortis Hospitals, Kolkata. Dr. You are in an area which is all about emergency. A warm welcome to you. You've been an amazing personality. Heard so much about you. And right here on Facebook Live.
Thank you so much.
Thank you so much for being with us.
It's my pleasure.
I must say you got a very charming smile. I must say that.
Thanks a lot for that too.
And next we have, of course, among the four doctors, Dr. Arindam Chakrabarty. Dr. Chakrabarty looks like a young college student, but trust me, he's a microbiologist and infection control officer at the Fortis Hospitals, Kolkata. It's so wonderful to have all of you with us right here live streaming on Facebook Live on the Friends FM page. First of all, I'd like to start off, I'm going to address each one of you all. In these trying times with COVID-19, normal patients are even scared to go to a hospital because their fear is that they may get an infection or something may go wrong. But I've been told, and my colleague has seen it, the kind of control and the kind of cleanliness and the kind of systems in place at Fortis, it's truly amazing. First of all, a big salute to all at Fortis for bringing such a beautiful ambience of cleanliness, hygiene, and interaction with the doctors and the hospital staff. So, doctor, let me start with Dr. Arindam Chakrabarty. Since you're the infection control officer, how can I feel safe? The worry is that if I go to a hospital, the danger would be I could get infected Oh, I'm not very sure. So Dr. Arindam Chakrabarty, Fortis has got the state of hygiene and cleanliness happening there. Do tell us a little bit about it. How are you controlling?
So, Jimmy, it is very legitimate in this world where we are all fighting this pandemic called COVID-19. We have got more than 8 million positive cases worldwide, and the pandemic has affected every corner of the world. But apart from the COVID-19, there are other aspects also in healthcare. The healthcare must move on. All our patients must come back to hospitals for their regular checkups, for management of the other ailments too. So in order to ensure that, we at Fortis Hospital, Anandapur, have taken many very important and critical steps to ensure the safety of all our patients. We are working day and night to provide safe environment in the hospital. We have got multiple SOPs in place wherein we are taking care of all the surfaces of our hospital. We are regularly disinfecting our hospital surfaces right from the entrance to the patient care areas. We have got very important measures taken to ensure the safety of our caregivers, means our healthcare workers, our staffs. So we have measures in place to ensure regular health checkup of all our healthcare staffs, and so that if any of them is presenting with any kinds of signs and symptoms of any illness, we can sort of identify them early and take necessary cares. We have got a very sort of prompt testing facility in our hospital also, wherein we have got corporate partners like the SRL, which is an NABL accredited lab which caters COVID testing, and we are sending samples whenever we feel like, to identify everyone who is carrying the virus, so that we can isolate those patients in the segregated designated areas of the hospital, and the rest of the hospital can work freely and cater to the other parts of the, like other ailments, other systems can work properly, and all our patients can come, avail the services and feel safe.
Doctor, you are one of the few private hospitals which are also tending to COVID-19 patients, you know, which is a remarkable feature, because there are shortage of hospital beds, there are shortage of, a lot of things in terms of COVID-19. But you're one of the few which is taking care of COVID-19 patients as well as non-COVID patients. So hats off to you all, because as I said, one of my colleagues have witnessed the hygiene, the cleanliness, and the organized fashion which you all are going about with. So people kind of feel absolutely safe. So Dr. Chakrabarty, if I have to just tell you to give a line, there are people out here saying, okay, I will ask the questions later, but they're saying very good afternoon to all the doctors. Rumni De, Kanchu Dotto, Ruma Roy, Nilanjana Khan, Rakesh Samanta are saying a big hello to all of you all. And it's so lovely to see you all on Facebook. So Dr. Chakrabarty, if I had to go to your hospital, and I wanted to go, what kind of a line would you tell me that would say, okay, I know this is the place to be at, because you've already said a lot of it? I think Dr. Chakrabarty, you had frozen a bit, so I got worried. So Dr. Chakrabarty, what I'll do is, I'm going to come back to you, but right now, I'll be going to the amazing lady out there, Dr. Sanjukta Dutta, who's head emergency medicine Fortis Hospital. Emergency medicine doctor. You must be having a lot on your head. A lot of medicine supplies during these trying times. You have to cater to all needs. So being a part of Fortis Hospital, how well are you all equipped, and how fast in a turnaround speed you're catering to the need of the want of emergency medicine?
See, our emergency is always equipped with everything what you can imagine in a ward and also in a critical care unit. So we have ICU ambulances, we have ventilator facilities, we have dialysis facility, we have 24 into 7 running all the radiology lab, blood bank, everything. The support is amazing. But the problem today is we are having huge number of patients who are coming as COVID suspects or COVID positives, and at the same time, there are really few patients who are coming with other ailments. We are doing our best to segregate both of them, but the problem is maybe people are scared. They are thinking that the COVID and non-COVID will be together, which is absolutely not. And what we are facing is we are getting more critical patients nowadays than before because people are afraid of coming to the hospital and they're coming late. And when they're coming, many of the times we really don't have much to give to them. I personally got a call, in my hospital nursing desk. A patient was telling that my father has got diseases symptoms, and I could understand that this is absolutely a major stroke. I told him you need to come to the emergency as soon as possible. He said, see, I don't want to go to any hospital right now because my father is elderly. So I am very much afraid if I go, something will happen to him. Basically, people are so afraid of COVID, they forgot that the COVID's mortality is not so high.
Absolutely.
There are many other diseases which has got much higher mortality rate than COVID. And when these patients are coming to us at much sicker state, it is very difficult for us to treat and save that patient. So that is a huge problem we are facing. Even if they're coming, they're not really ready to be in the hospital. They want to go back. Maybe they want to go to the OPD, see a doctor and go back to home. So a few days back, we had a patient who actually required admission for some ailments, but he was so unwilling to be admitted and went back without our consent. Kind of, they can go with their own sign and own risk. And at home, he was so weak, he fell down, had a fractured hip, and then came again on the next day. So these are the things happening in the society, and in other medias also, I'm trying to reassure people and tell that there are other killers which can kill you. It's not just COVID, and COVID's mortality is actually low. It is definitely a big problem for a nation because we have 130 crore people. Even if the mortality is very minimum, there will be many fatalities. But for an individual, it is not so deadly like some other diseases which are actually bad. So these diseases should not be ignored, and the patient should not be at home neglecting those ailments.
Absolutely. We see that people having ailments, heart problems, or, minor other disease are too scared to come to the hospital. And I totally agree with you. And I'd like to also say on this online forum that COVID-19 is not dangerous. It is contagious. So people should not feel scared ki, are, amar hoye jabe. 14 din quarantine kore dao, automatically it moves out of your system. But I think, and I do agree, like, for example, there have been cases of people having strokes, heart attacks, small little ailments which actually become bigger ailments. So people should immediately get it attended to rather than say, Nami bari theke treatment korbo. And knowing how Fortis is operating, I think it is a beautiful, clean and hygienic atmosphere with a lot of safety. As I said, we've gone there, we've seen it, and we've seen it with our own eyes. Thank you, Dr. Dutta. And of course, now on to Dr. Banerjee. Of course, he's consultant, Department of Internal Medicine, Fortis Hospitals. Doctor, before I get on, listeners asked me this question. I don't know how far it's relevant, saying that, Ruma Roy, doctor, please tell us about vitamin C. If we have vitamin C, is it good for the immunity system and build up against COVID-19? Ami to jani na, but there are a lot of things people say, vitamin C, vitamin D, onek kichu bolo. So what is your take about just having tablets without a doctor's prescription? I don't think that's right. What do you feel? Doctor, your mic is on mute. Yes, doctor.
To fight with coronavirus, immunological boosting is definitely very important. But one part we have to keep in mind, in our internal medicine, there is no such medicine what you will consume and next day your immunity will accelerate like anything and corona will flee away. So it's not possible. There are a lot of suggestions, Ayurvedic suggestions from Ministry of Ayush. You can visit the website of Ministry of Ayush. So they have different suggestions, but in our allopathy medicine and in our internal medicine, there is no evidence of giving multivitamins or vitamin C, or initially it was told zinc can help you to eliminate or to prevent the severity of the COVID infection, but there is no such documentation by which we can tell you if you take this medicine, your immunity will accelerate in such a fashion, the COVID virus or COVID infection will be eliminated. But my one utmost request to you, Jimmy,
Yes, sir.
for everyone, prevention is better than cure. If we follow 4 health protocols, that is wearing face cover, if we maintain cough etiquettes, if we wash our hand or sanitize our hand, and if we maintain physical distance, but social bonding should be strengthened. We will maintain physical distance, but if we don't strengthen our social bonding, then whole society will break down for corona. So my suggestion, better to cover your face, better to sanitize your hand and wash your hand, better to maintain cough etiquette, and please maintain physical distance. I know maintaining physical distance in a country having population density of 506 per square kilometer. In West Bengal, this population density is 10,000, and in Calcutta, the population density is 24,100. So having city, having state, having country, this population density, maintaining physical distance is a more of theoretical. So better we must be very much strict for covering our face and washing our hand.
Dr. Banerjee, since Department of Internal Medicine, Fortis hospitals, what would you like to tell us about your preparedness to handle or tackle any situation or any eventuality which comes your way at the Fortis hospital?
See, we have started our journey 4 months back. Arindam, Sanjukta, me, Shuvanan, all the whole team. We have a big team. Dr. Dhar, Dr. Paliwal, endless. I can tell you our whole administration supported like anything. We build up a COVID team, and we have made a protocol. We have made a protocol where when you are entering into the hospital, you will be screened by a form. What are the features you are having? There will be someone with a thermal gun. They will check up your temperature. And if you are having fever, you will go to fever clinic. Otherwise, you will go to the normal clinic. Now, when you are in fever clinic, if we suspect you are having COVID, we will going for your testing. And after testing, if you are having positive, we are having our lovely COVID unit where you will be admitted, and according to your situation, you may be admitted either in the isolation ward or in the ICU, and accordingly you will be treated and taken care of. But one thing I am telling you, our sisters, our healthcare workers, our doctors, our senior consultants, our administration, everyone is helping. They are day and night working for this COVID team. Hence, in Fortis Hospital, it is a private hospital, still it is a very important partner of COVID fight in West Bengal right at this moment.
Absolutely, doctor. I've heard about it because we have spoken to certain patients who have come out of Fortis, and they've said the treatment has been exemplary. You know, they've actually felt that they've been at home. The ambience, the atmosphere, the courtesy, the care has been exemplary. So I'm sure it's an amazing job you all are doing. One side taking care of COVID patients, and the other side also taking care of non-COVID patients under the same platform. Hats off to you all. Seriously, hats off to you all, because I think somewhere or another, Fortis was one of the first hospitals to lead the way in the private area, you know, to have beds for COVID-19 patients, simultaneously also carry on with what you all have been carry on to treat all your normal patients. Thank you, Dr. Banerjee. Now, of course, we are on to a gentleman who mends the hearts. Dr. Shuvanan Ray, Dr. Ray, namaskar and a warm welcome right here on the live stream.
Thank you very much.
Doctor, you know, in these trying times, being a part of Fortis, and people are anxious, people are scared, people even with heart ailments don't want to go to the hospital. People generally want to phone up and take tablets or medication. People are worried about if suppose someone had a heart attack, you know, there will be an emergency situation, there will be a trying time. So I'm sure Fortis Hospital, the way you all are working, especially where cardiac care is concerned, is of the highest order. So doctor, how do you feel in these trying times with COVID on one side, and of course with other ailments, and especially a lot of heart ailments which are also cropping up? How you all are managing to, you know, work alongside and do such an excellent job?
I'm very lucky to have all my friends together, you know, friends like Sanjukta, like Sibabrata Banerjee, like Paliwal, Yashish Paliwal, and all of us sat way before, you know, the COVID broke into our country. And we maintained a protocol. We made a protocol that sometimes in the trying times of COVID, many people will be coming with heart attacks. What we need to do. And, you know, it was already seen in different parts of the world that in heart attack patients, if we take them straight to the cath lab, which we used to do in our earlier times, there will be a chance of infection to the cath lab sisters, nurses, and healthcare workers. Also, there is sometimes that it becomes a futile exercise because sometimes the arteries are normal even with a heart attack. So we made a protocol that whenever a patient comes to the hospital within the stipulated time of heart attack, that it is the job of Sanjukta in the emergency. They do an emergency thrombolysis, and exactly they give a drug to melt the clot. After that, we screen him for COVID, and if he is negative, then we move him to cath lab and do our procedure. Otherwise, we just, if he is positive, he goes to the COVID OPT. We had a patient, few days back, who is one of our, workers who had a heart attack, got thrombolized. He became positive of COVID, went to the COVID ICU, looked after well by Shuvanan and his team, and he came back again for angiography. He will be coming for angiography maybe a day or two. This is a quite normal phenomenon in our hospital right at the moment. So we do not mix up with patients, and we segregate our patients so well that there is a very little chance of getting infection in our ICU or in the cardiac care unit. So in cardiac care unit, we already screen the people. Then we take him up for angioplasty or something procedures, and with a very quick time, and even after an angioplasty, we discharge them within a day or two, maybe after 24 hours in most of the cases, so that the chances of infection is least.
Doctor, that's amazing. Within 24 hours in most of the cases. I mean,
yeah. Usually we go by radial route, and if there is a radial route angioplasty, we discharge the patient in all stable patients are discharged within 24 hours.
Wow. We have a message from Spandan Sengupta right here on the Facebook live stream, saying a big salute and respect to all of you doctors. You all are doing an amazing job. In fact, that is the standard message across everybody, giving a big salute to all of you all to bring about so much of positivity. Jodi positivity thakbe, amra egiye ashbo. That's what's important. And Fortis, being what it is, and we can see it from the way you all have got across to all of us, talking about the checks, the systems in place, the facilities available, the back end, no headaches on running around, a very clear protocol and direction of work, which brings about all the safety, all the sanitization, as well as ensuring that the patients get better and go back home. Now, doctor, since we have the world watching on Facebook Live, and we've heard from each one of y'all the precautions and the way departments are being handled, the way y'all are going about of ensuring that Fortis is an exemplary, one of its kind in Eastern India, taking care of COVID and non-COVID. So to start off with Dr. Banerjee, we have a lot of people watching us, not just in Calcutta, but also in India and across the world. In these trying times, what would be a message from you to the entire world, on behalf of Fortis right here in Calcutta? And of course, being a doctor, your message across.
Right at this moment where we are basically in the accelerating phase of the first wave. So please keep yourself mentally ready for the third week of the July, where probably we will reach the peak of this wave. So lockdown is not possible to continue so long. So what we have to do, we have to protect ourselves. Protecting yourself, you can serve whole India and whole world. So again, I am reminding everyone, covering face, cough etiquette, hand washing and sanitization, and physical distancing but social bonding. These are very much important message to protect yourself, to protect your country, and to protect whole globe from the coronavirus.
Thank you, Dr. Banerjee. That was really beautifully put across. I don't think anyone could have said it better. Dr. Sanjukta, Doctor, what would your message, being a part of Fortis, doing so much, experiencing so many patients across and being a support, what would be your message to the world?
Yeah, actually, Dr. Banerjee has told much of it, but I would like to tell that please take caution, be serious about it. It is nothing that you would neglect, but please do not panic, because panicking is not going to help you out. And also, if the lockdown is not there, that doesn't mean that COVID has gone down. As he rightly said, that it is actually accelerating. So we need to be cautious. We should not panic. And we need to know that there are three routes from where the COVID goes inside. That is, one is eyes, nose, and mouth. So we are inhaling, and we can actually touch something which has got COVID and touch our own eyes, nose with the dirty hand. So the hand sanitization and of course the cough etiquettes and all those are very important. If possible, wear a specs or a goggles when you are outside, because somebody is coughing in front of you, talking, something is coming into your eyes, that is also a possible source. But it doesn't mean that people will have to go in PP on the roads. It is not. Because few days back, somebody was asking me, I need to go to a marriage ceremony, should I wear a PP? So that kind of questions are also coming. So that is not absolutely required. And at the same time, I believe take some responsibility of the society as well. We are not safe as an individual, but we need to be safe as a society. So if somebody is not maintaining those etiquettes, somebody is in front of you and not wearing a mask, not covering his face, nose, mouth, so talk to him. It doesn't matter if he is your driver or if he is unknown person. We all should do this. Somebody is spitting in public, tell no to that. Because if we learned people, if we do not take care, we do not really expect the illiterate people, the poor people to take care of the society. So first we need to take responsibility ourselves. Then only the society will learn. And also, please do not share all those posts which you get on WhatsApp. Those are really misleading. And as a doctor, I get so many questions, and those are so insane. I mean, I really do not know how to answer those. Should I take this homeopathic medication? Does dexamethasone will help Should I take dexamethasone tablet? So there are so many. Please do not share a post if you are unsure about the authenticity.
Absolutely.
So this is very important, I feel. And also what I told before, COVID is very contagious. It spreads very easily, but it doesn't mean that it is very deadly. There are many other issues. Even today, I mean, dengue is coming. This rainy season, we will get so many dengues. Dengues kill young patients, young people. So there are many other diseases which are much stronger killers. So don't panic about COVID as it is contagious. Try to reduce the spread. And also remember that people are afraid about the kids. The kids are most safe from COVID virus. The people who are actually unsafe, those are elderly people. So if you have elderly people at home, keep them segregated. Do not worry about the kid most. This time, care about your parents more. So that is more important. And also, if you are sick, please do not hesitate to come to a hospital. Do not hesitate to come to an emergency if you are having some emergency condition to visit a doctor. Because if you neglect, maybe COVID will not touch you, or maybe even if you are outside in the society, you never know when COVID can touch you. So you will neglect one bigger killer than COVID, and that can be really deadly. So I think we need to take care of all these things so that we can maintain a healthy life for us, for our society.
Thank you, Dr. Dutta. It was amazing and really appreciate it. And now on to Dr. Arindam Chakrabarty, infection control officer at the Fortis Hospital, and of course a microbiologist. You've been into it also in a big way. You understood it, whether it be infection of COVID or another infection or a normal case. What would be your message to the world, sir? What would you like to tell them on behalf of Fortis and behalf of yourself?
Yeah, what I can tell is, as a country and its economy needs to move ahead, needs to move on, social distancing or physical distancing, as they say, will become increasingly difficult to maintain. So what we need to pay heed to is maintaining personal hygiene all the time when we go out of our home. We must mask ourselves, we must wash our hands or carry an alcohol-based hand sanitizer all the time. We must disinfect our smaller gadgets like our mobile phone, our earpads and iPads and all those things. And we, at the same time, must understand that prompt and early reporting of any symptoms suggestive of COVID-19, like fever, dry cough, sore throat, and to consult an expert can reduce the morbidity and the chances of mortality in this disease. So if you feel feverish, if you have sore throat, get an expert advice. We have got in our Fortis hospital, the fever clinic running, the emergency running. So you can come to us, get an expert advice, expert opinion. And if the experts think that your symptoms are suggestive of COVID-19, then you'll get tested. As West Bengal currently is doing a lot of COVID testing, it is sort of doing exemplary COVID testing in our country. And the testing has become cheaper also in recent times. So getting tested early, getting diagnosed early, and getting the treatment early can reduce your sufferings later on. So maintaining personal hygiene along with physical distancing and obtaining expert advice, expert opinion, and get a test done if required is very important.
Thank you, Doctor. You know, it's so important to ensure that we take care of ourselves, because if we are positive, we are happy, our immunity system also grows. And any ailment, not just COVID-19, I think Fortis is there for you. Of course, we have the gentleman, of course, with the heart, I always say. And Dr. Shuvanan Ray, Dr. Ray, your message to the world. Everybody's watching you in Calcutta, India, and across the world. What would you like to tell them on behalf of Fortis and behalf of yourself?
Basically, I deal with a disease which has got a more, virulence than COVID itself. The heart disease can kill a person in around 30% of the cases, whereas the COVID is 5 to 10%, not more than that. So it is more dangerous a disease. So if anybody has symptoms of heart attack or any chest pain, which is likely to be a heart disease, or anybody who is having heart disease, having a new resurgence of the symptoms, should not make any delay. Please come to our hospital. We have separate everything. Separate and well segregated unit where you will be safe and procedures will be done very safely, and you can avoid mortality and death. And so, cardiac disease, if you do neglect the cardiac disease, the death is only answered. Basically, for that reason, I must say that COVID or non-COVID, do not neglect the cardiac symptoms.
Absolutely. Thank you so much. Of course, Dr. Shuvanan, Dr. Sibabrata Banerjee, Sanjukta, Dutta, Dr. Arindam Chakrabarty. It's been such a beautiful heart-to-heart conversation. So many things where many of us were not aware, were told. Plus, we've seen and we've got to hear from you the readiness of the Fortis Hospital, where everything and every angle is taken into consideration, whether you be COVID-19 infected or be a normal patient. So my humble request to everybody out there who's hearing us, watching us, that if you have any symptoms, not just of COVID-19, anything, it's time you get yourself checked up. Don't worry about, how safe it is, because you've just seen the safety methods Fortis has kind of implemented in all cases, in all areas, and taken everything into consideration. Well, we have the iconic doctors who are COVID warriors, who are warriors within themselves, who are online and on station doing so much, So I'm sure even they are knowing and they are aware of the entire organization, the criteria of safety checks taken, because no doctor would be online, on ground, even doing his work with so much of energy, if they were not sure of the security and the hygiene conditions in the area they're working. You can see by their expressions, by the way they've engaged, that they are actually online, they are on ground, they are right there at Fortis, taking care of a lot of patients with a lot of systems in place. And as Dr. Dotto says, we have all the facilities under one roof and everything on earth is there. So there's no running about. But thank you so much, doctors. It was such a pleasure to talk to all of you all from the Fortis, absolutely live. And once again, on behalf of 91.9 Friends FM, on behalf of the city of Calcutta, on behalf of the country, and on behalf of the world, a big salute to all of you all for always being there. Onek onek dhanyawad, and thank you for being with us on this live stream.
Thank you, Jimmy.
Thank you so much. God bless.
Thank you.
Take care. Thank you.